Hi, my name is Caleb Noviello. I'm in the graduate exercise physiology program at Valdosta State University, and today I'm going to be presenting on Parkinson's disease. What is Parkinson's disease? It is a neurodegenerative disorder that progressively degenerates the basal ganglia and affects the major dopamine pathway in the brain. This disease is one of the major central nervous system disorders that has affected a large number of individuals in the world that are over the age of 60. So the epidemiology, currently there are about 1 million Americans that have been diagnosed with Parkinson's disease, with 60,000 new cases occurring every year. Currently in the world, there are over 10 million people that have been diagnosed with Parkinson's disease. When we look at gender, men are 1.5 times more likely to have Parkinson's disease than women. And as a person gets older, the likelihood of them developing Parkinson's increases, with the onset occurring after the age of 40. Pathophysiology. The development of primary Parkinson's disease is unknown, but several factors play a role in diagnosing Parkinson's disease. There have been several different genes linked to identifying Parkinson's disease and people who are at risk for Parkinson's. Primary feature of Parkinson's is the loss of dopaminergic pigmented neurons in the substantia nigra, along with dopamine loss in other major areas of the brain. Degeneration of pathways to the basal ganglia affect motor function and cause slowness of movement and muscle rigidity. And several proteins act as neural degeneration markers within the blood in the body. So some signs and symptoms of Parkinson's. A big one is bradykinesia, which is slowed movement. People who have Parkinson's often take longer to do small daily tasks like buttoning their shirt. So you often see these patients taking longer to do minuscule tasks. They also have muscle rigidity, which is normally presented in their joints. So we're looking at wrists, elbows, knees, and there are different types of muscle rigidity that we will get into in a minute. A big sign or symptom of Parkinson's is a tremor at rest, which is also called a Parkinsonian tremor, which we will get into in a minute. There's instability in their posture, so with those motor pathways being affected, there's loss of muscle tone. So often you see Parkinson's patients with a rounded forward posture, shoulders are rounded forward and they can't really stand up straight. There's also cognitive impairment, so there's a slowness of thinking, and there's sleep problems and mood disorders that come along with it as well. Signs and symptoms continued. So symptoms don't start to appear until 70 to 80% of the pigmented nigral neurons have been lost, and 60 to 90% of striatal dopamine has been lost. So going back to some of the symptoms that we talked about earlier, the Parkinsonian tremor. It's normally one of the first symptoms that shows up in these patients, and oftentimes you'll see it in little changes in their handwriting that affect how they move. But a Parkinsonian tremor is a pill-rolling tremor at rest, and the key thing about this kind of tremor compared to other disorders or diseases is that the tremor will stop when the patient goes to move. So if their hand is tremoring and as soon as they go to move, it stops. There's two types of plastic rigidity that are associated with Parkinson's. One is plastic rigidity. So this means that the person's joints have resistance all the way through passive motion. So if I'm trying to move a Parkinson's patient's arm, there's going to be resistance in that motion. Also, there's cogwheel rigidity, which is similar to plastic rigidity, but through that passive range of motion, you can actually feel a jerking movement that is similar to a ratchet wrench. Another big thing that has been discovered is that approximately 30 to 40% of Parkinson's disease patients have depression. And this depression isn't due to circumstance or what's going on outside of the disease. It is the actual pathologic state of the disease. And a comprehensive study has been done to show that people who have depression are more likely to develop Parkinson's. So treatment. A big part of treatment for Parkinson's disease is drug therapy. So we're looking to increase the dopamine levels that have been decreased due to the degeneration of the dopamine producing cells. So drugs such as L-Dopa are used to increase dopamine levels. L-Dopa is a precursor to dopamine that can cross the blood-brain barrier, and dopamine can't. So using that drug allows the precursor to cross over and eventually become dopamine. And then we also look at drugs such as monoamine oxidase B inhibitors. Later on in the stages of Parkinson's, surgery is an option. Something that is very common nowadays is we look at brain stimulation to help those neurons fire. And then we also look at cell and gene therapy that are possible treatments for the future. Some other types of therapy that can be used is occupational therapy, physical therapy to help improve the functional status of a person. We could also look at swallow therapy, because oftentimes Parkinson's patients lose muscle control in their face and upper airway. So swallow therapy, speech therapy, things of that nature. And then as an exercise physiologist, I tend to look at exercise as treatment for a disease. So exercise helps develop and maintain overall health. So looking at cardiovascular fitness, respiratory fitness, muscular strength, and endurance. So with Parkinson's patients, we can look at aerobic training, strength training, mobility training, and neuromotor training. So with aerobic training, we're trying to increase their cardiovascular fitness. Strength training, we want to keep those muscles strong to be able to maintain the activities of daily living. Mobility training is definitely going to help with the muscle rigidity and trying to keep those muscles flexible. And then we also look at neuromotor training to help improve and maintain coordination. So all of these different types of training help with balance, coordination, and activities of daily living. So my case study is actually looking at my grandfather. He was diagnosed with Parkinson's in 1990, and he passed away in 2011. So he lived with Parkinson's for about 21 years. Over that time, he slowly developed classic signs and symptoms of Parkinson's. A big one for him that I remember was his walking. There was always a shuffle step, shuffle gait when he walked, and he often needed help and assistance in walking and had to use a walker in the later stages of his life. Something else that he developed was the Parkinsonian tremor. It mostly developed in his hands, which is the Parkinsonian tremor is actually more common in the hands than the feet. And I remember when he would go to reach for something, that his hand would become more stable than at rest. He also developed muscle rigidity, so looking at the elbows, his elbow was always slightly flexed, his knee was always slightly flexed, and when he did walk without his walker, his arm stayed in the same position, so he lost that arm swing as he walked. So to help with his symptoms, he participated in physical therapy, occupational therapy, and took drugs such as L-Dopa to help increase those dopamine levels. So my grandfather was the classic case of Parkinson's disease. So in conclusions, Parkinson's disease is a common neurologic disorder across the world, especially in men. Signs and symptoms start to occur in the later years of life, and Parkinson's disease can be treated through drugs and therapy. Research is being done every day to find new treatments and possible cures for the disease. The Michael J. Fox and Parkinson's Foundations are two of the main foundations that are contributing to said research. Thank you for listening today, and I hope you learned something.